that second chance for a break that would make it okay. There's always some reason to feel not good enough, and it's hard at the end of the day. I need some distraction, oh, beautiful release. Memories seep from my veins. Let me be empty, oh, weightless, and maybe I'll find some peace tonight in the arms of the angel. Fly away from here, from this dark, cold hotel room and the endlessness that you fear. You are pulled from the wreckage of your silent reverie. You're in the arms of the angel. May you find some comfort here.
The original tape was the invention of Dr. Jim Broselow, an emergency physician of North Carolina. Dr. Broselow, by his own admission, felt comfortable with caring for sick adults, but when the patient was a critically ill or injured child, he lacked confidence. He developed a simple tool to increase the accuracy of weight estimation using height-weight correlations from the National Center for Health Statistics. The Broselow Pediatrics Emergency Tape has become an industry standard in pediatrics emergency care. It helps to simplify some of the decision-making in an emergency by eliminating the need to calculate the correct dosage for a medication. In order to provide the proper dosage of a medication to the child, a provider must know the child's weight in kilograms, the dose per kilogram, and the available concentration of the specific drug. The Broselow Pediatric Emergency Tape provides a tool for determining the correct dosage of medication and equipment sizes for children based on their length. By using the color-coded system of the Broselow Tape, a provider is able to concentrate on more important factors of care during an emergency, such as securing an airway, maintaining circulation, and making a field diagnosis and transport decision. The tape is recommended for use on any child under the age of 12 years old. For any other child that is longer than the tape, the provider should use adult dosages and equipment.
Okay, one of the pieces of equipment we use here is our Broselow bag. It goes right with the Broselow tape. Broselow tape is one of the best tools that's been created for infants. It's all color coordinated with sizes. The drugs are already on there. You don't have to do any of the guesswork pulling up the drugs. You know, say they're yellow, you got the yellow bag. Everything's in there ready to go. Orange bag, you lay it out, you put it at the head of the baby, and you can start working immediately. All your drug calculations right there on it, what size tube, and whatnot. Good, real helpful with pediatric codes, takes the stress level off the medic, allows you to think more about the patient care and not that you're working on a baby. Pursue the results you're looking for. The only thing that's not in the Broselow kit are the actual drugs needed. We still carry our drug bags for that, but besides that, it's all here, ready to go, ready to deploy quickly.
You are dispatched to a daycare facility at 9:45 for a 4-year-old female who is actively seizing. Upon arrival, you find your patient convulsing on the floor, having what appears to be a grand mal seizure. As always, you must first maintain the airway and make sure your patient is safe. Your next priority is to stop the seizure. Per local protocol, midazolam is your first-line drug. The dosage of midazolam Versed for an actively seizing pediatric patient is 0.1 to 0.2 milligrams per kilogram IM. You are going to need the weight in pounds for this patient, which could prove to be very difficult from the frantic daycare employee. She gives you her best guess at 20 pounds. To convert pounds to kilograms, we use the formula pounds divided by 2.2 equals kilograms. Weight is 9 kilograms. To obtain our correct dosage, we multiply 9 kilograms by 0.2. This equals 1.8. We now know that we need to give 1.8 milligram midazolam to our patient. The concentration of midazolam is 5 milligrams per mil. How many ml do we push to give our patient 1.8 milligrams? The formula to calculate how many mLs to give for 1.8 milligrams is shown. Our answer is 0.36 ml. The Broselow tape was designed to simplify the calculation above in order to decrease instances of miscalculations. It's obvious that the use of the Broselow tape in emergent situations can help to make a difference in a child's life.